Snow and ice are coming, right? And with that, a greater chance of taking a spill. Tara Newsom is here from Embassy Healthcare with some tips to prevent falling. And it's funny, you go to the doctor and you get to be a certain age, like 50, and the first thing they ask you is, how many times did you fall down this year?
Oh my goodness.
I mean, it's really a big deal.
It
fall
is a big
really
deal.
A terrible thing to happen to a person.
It is. Per the CDC, falls are the leading cause to injury and death in older adults. So thank you for having me here today to talk about falls.
I'm trying not to fall down. You're going to help me.
Don't fall.
No.
Although if you do, we can take care of you at Embassy Healthcare,
Well,
for sure.
I can hardly wait.
Good.
Okay, so let's talk about falling a little bit. You know, we talk about ice and snow, but there are a lot of other reasons that people have falls, isn't there?
Absolutely. I just want to talk about the nature of falls a little bit. When you have a fall, that individual now has fear. Fear sets in. And unfortunately, when they're fearful of falling again, they stop participating in activities that they normally would have done prior to that fall.
Ah.
So then they become isolated, possibly depression sets in, and now decreased activity. So the combination of fear, decreased activity, now puts that individual at an increased risk for a fall again. So then falls—
Because they're getting weaker and weaker.
Right, right. Falls in nature become cyclical. So you want to do some things to prevent falls. I have some tips today to share with your viewers,
Okay,
and hopefully they can go
one.
for them. Okay, great. Yes, so something you can do to prevent a fall, you can do right now in your home. Remove those obstacles that are tripping hazards. Clear the clutter from your steps.
Roller skates on the floor, like that
Oh
kind of
goodness,
thing? Like
get the kids'
cartoons?
toys out of there, absolutely. Move the boxes out of the hallway. Additional, you can put handrails on near your stairway. Increase your lighting by your staircase. We do often recommend putting grab bars in the bathroom area, shub tower area. It gives the individual something to hold on securely when entering or exiting a tub.
You know, we keep talking about the individual and for people and doing this and such. What age group are we talking about that we should start thinking about this?
Oh my goodness, you wouldn't think that you would have to think about this now in your 40s, 30s, 60s. There's never a bad age to prevent falls. Definitely with our older adults, you know, the 65 and older population, you know, is really where I'm targeting my discussion towards.
Right.
But it's never a bad time to plan safety and intervention.
Well, I know almost anyone can come blasting around a corner and hit one of those throw rugs or those little decorative oriental rugs or something, and you can go flying like in the cartoons.
I'm so glad you brought that up. That was another great tip to share with our viewers today. If you can't securely keep that throw rug down with double-sided tape or a hard rubber back where the edges don't curl up, I just suggest removing it completely from the environment and prevent that fall.
Some people are taking medications that make them not feel pain or blood pressure. You know, blood pressure down too fast, you get a little faint or whatever. So can drugs play a part in this fall thing?
Absolutely. You should speak regularly to your healthcare provider or a pharmacist to regularly check your medication for side effects or interactions that may make you likely to fall. Absolutely.
So Embassy Healthcare, like we're talking about, like you talk about, maybe they live by themselves or with somebody, they fall, they don't tell anybody, and then you know you see these things happening where they start to get a little more like staying in their chair, they're not getting up enough, or they fall and need some help. Where could they get some help if they fall?
They absolutely need to report the fall to their physician. I believe 1 out of 4 people that fall do not even report that to their physician. So you can actually contact Embassy Healthcare, let us know, or talk to your doctor for a referral for a physical therapist or an occupational therapist to assess the resident or the individual. We would be happy to see them come on to Embassy Healthcare, where therapists are the experts at assessing for reducing your risk for for falls. So we would be happy.
The big message is stay on your feet for the holidays, please.
Absolutely.
Out of your seat and on your feet.
I was trying to go quick.
No, you did great. Thank you very much.
Thanks.
Nat?